start the day with a cup of coffee. It's funny, I didn't drink coffee until the last week of medical school. You know, all my friends drank it, I didn't. And then the last rotation of medical school, I started drinking it. Haven't stopped. I am Dr. Tom MacGillivray. I'm the chair of cardiac surgery at MedStar Health. I also serve as the vice president of medical operations for the MedStar Heart and Vascular Institute. I primarily do my patient care at MedStar Washington Hospital Center in DC. Here we are. You guys going? Cardiac surgery is, I think, the best specialty in medicine. And being a cardiac surgeon is the best job in the world.
Dialysis.
So it's great to before there would have to be 6.
Being a little bit more proactive about, preoperatively. I look at this as kind of like a flashing yellow light.
And a much better replacement in cabbage, both greater than...
Up in my head, I can't think of what that reason would be. This is cardiac surgery step-down unit stuff. Thanks for getting all that information and data together. It's a lot. We just had our quality conference. And what that allows us to do is to look at all of our data and look at individual quality metrics and how our patients do compared to the national benchmarks, and take the information to try to put into place performance improvement plans so that we continue to get better, to help our patients get better. Patients choose MedStar Health for their cardiac care because we provide the patients and their families with the best experience. The secret to taking good care of a patient is caring about the patient. Our team really cares about the patient. I'm going to go meet with a new patient who's got coronary artery disease. Hi there.
Hi, Seth Stark. How are you?
Yeah, Tom MacGillivray.
Very nice to meet you.
When I first meet with a patient, I still am flattered that patients want me to take care of them and do their operation. And I think the first meeting with the patient is very important. It's important to take the time needed to explain their heart condition, to explain the operation, and to listen to them and answer their questions. First thing we'll do after you go into the operating room is get you off to sleep. That is not only an informational experience, but it's also one where you develop a relationship and a trust. Because it does require for somebody to sign that paper to have heart surgery, that they trust you.
Yeah.
Yeah, everything, yeah.
Those are the glory days.
And that's a very important part of that initial meeting, to develop that relationship of trust.
And annular calcification.
Yeah, so I think that would be an appropriate thing to do. Good morning, good morning. You doing okay?
Yes.
Everybody is very nervous when they're coming in to have heart surgery. They're with their families, they're very nervous. So as we talked about today, we're planning on, we're going to replace those 2 valves. Any questions I can answer for all of you? Or?
You guys have been pretty thorough. We're ready to rock and roll.
Oh, good. So coming in, having them see a familiar face, trying to just put them at ease as best you can. So when they roll into the operating room, they feel safe, they feel confident. Helping them with their concerns and their anxieties are also a big part of taking care of them and helping their families. So it's mostly, at least by the imaging, it's sort of right in the middle. Most of the operations take 3 or 4 hours. In any one component of a multiple component heart surgery operation, any one component would be a big operation. It's like a symphony, how to put it all together to make it work. Yes, we're going to go talk with the family. We're done with the operation. Just let them know how she's doing. She's doing well. A big operation, but doing well. So we're all done. Everything's good.
Okay, great.
Her valve, the mitral valve, was as if the frame of the door was all kind of overgrown, and the frame itself had been all calcified. And so there was a bunch of calcium on the top of the mitral valve that was interfering with flow out of the aortic valve. So we took all that away.
We are good, and
Good.
thank you so much.
You're welcome. Okay. I'll be keeping an eye on her.
Thank you.
Sure, you're welcome. Sitting in the waiting room for all day with a long operation it's very hard to do. For those who have never had to do that, it's a hard, long day to do that. So it's always good to come out and give people good news. Part of my job, in addition to performing the operation, is helping to coordinate and make sure that the patient gets absolutely the best care that they need. It's not about the operation, it's about the patient. Hi.
Good morning.
Hi, good morning. So, coming to see Mr. Stark. I saw him last night, late at night, and he was looking pretty good.
But he looks so much better.
Yeah.
He said that ice water and ginger ale tasted better today than anything's ever had in his life.
What you'll find is that you'll start to notice the short periods where you feel pretty good, and then it's like somebody flips a switch and you just feel exhausted. And that's normal.
Well, if I would say another night, the care has been unbelievable.
Yeah, well,
Everybody's
good.
just been outstanding. It's been good here.
Stacy does all the work, I take all the credit. I want to take care of a patient the way I would want someone to take care of a member of my own family. And that's always the benchmark question I ask when I make a recommendation to someone, to a patient or their family, is that something that I would feel comfortable and confident if someone were to tell that to a member of my own family? And if the answer to that is yes, that's the right answer.